If you are battling shin splints, and I know how painful that can be, we want to show you some exercises to help you get better, hopefully without even seeing a doctor. I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist, here with my friend and physical therapist, Yves Gege, and he's going to show us and talk about shin splints. This is an irritation, an inflammation of the lining of the bone of the front of your tibia or your shin bone. Typically see it in runners, but you can see it in all kinds of athletes, and it's this dull, achy pain that just drives you crazy. Sometimes you can train through it, but it can get so bad that you may not be able to run through it after a while. So we want to show you some things that as this starts to get painful and it starts to bother you, you can start doing these exercises to hopefully prevent it from getting into a much bigger problem.
So here are our favorite exercises that you can try at home. We really want to focus on is improving ankle range of motion, right? You're usually using that a lot for walking, especially for running. So if we can make some more room for that ankle to move, we've noticed that a lot of that pain can start to go away.
Awesome.
So the first exercise we're going to do is for the ankle, and it's for the motion where you're pulling your foot up.
Okay.
So you can find a curve, you can find a step. Yep. You're going to keep your heel planted on the floor. You're going to put the ball of your foot on top of the elevated surface, and you're going to lean forward actually with your hip. You're almost going to pretend like I'm pulling a string with David's hip here and lean forward. And you should feel that in the back of the calf, back of the leg, maybe even a little bit in the tendon back there as well. You want to hold that anywhere from 30 seconds to a minute. I would say do both sides, 2 or 3 sets.
It's probably a good exercise to do even if you don't have shin splints, honestly.
Yeah.
You can really feel that. That's really good. Okay.
Okay, so we've fixed one motion, and now we want to focus on the other. We've worked on pulling it up, and now we want to focus on the other motion. So what we're going to do is actually going to get down on our hands and knees.
All right.
And this one's excellent because it's actually really hitting that spot that is sore. I've had a lot of patients tell me that this is an exercise that makes them feel immediately better when they're sore. So it's a great thing to try if you're actually having acute pain right away.
Okay.
Okay, so you're on your hands and knees. You want to make sure and keep your ankles flat, just like David has them. Toes not underneath you, but actually flat. And then you want to sit your hips back into the ankle as far as you can until you feel a stretch in that area.
Oh.
Yep. In that shin splint area.
He's not messing around here. Holy smokes.
If this is a little too painful, you can at home use a pillow or something like that and put it underneath your knees, and that can be a little bit more comfortable and something you can work into doing it how David's doing it, which is totally flat.
How long do you hold that? You get it to where it's tight and then hold it for 10, 15 seconds, or as long as until you can't take it anymore? How long should you go?
This one, I tend to hold it a little bit longer than traditional stretches, so I'll actually hold it anywhere from 1 minute to 2 minutes.
Yikes.
So I really feel that ankle start to loosen up and that shin splint pain start to go away. So hold it as long as you can. That's why it might be important for that pillow to make it a little bit more comfortable and sustainable. Okay,
and I see you've got a lacrosse ball there. How would I use that?
Okay, so a lot of people know that the pain-reducing effects of massage. So this lacrosse ball can be a great way to do the same stuff at home. So in that shin splint area, we can start to roll and put pressure on those shin splint spots.
Okay.
Roll it on there for anywhere from like 30 seconds to a minute.
Yeah, since it's typically sort of a broad area, I can see how that would be helpful.
Yeah.
So you do both stretches and do that every day, couple times a day? What's your kind of thoughts on how much you should target this?
Yeah, I would say daily. You know, you can even do this across the ball multiple times daily, right? Really start to loosen up those muscles and start to feeling better.
Okay, terrific. If you have shin splints, definitely try these. It can't hurt, and hopefully it gets you back to running without any heroic treatments or even going to see the doctor. If you're not getting better, then definitely check with a physical therapist or go see an orthopedic surgeon and get back to what you love to do. If you want more information on shin splints, click the links below. You'll also find information to Yves' social media. Get all kinds of great information for physical therapy and all kinds of health and workout and weightlifting tips as well. Make sure to subscribe to my video channel for all sorts of sports medicine information, and we look forward to seeing you again in our next video.